this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You're watching Aging Strong, which is sponsored by the Quincy Health Department. Today, I have a special guest speaker. She is one of the occupational therapists at Tufts Medical Center. Her name is Michelle Kay. Michelle, welcome.
Hi, thank you.
Yeah, so I know we were just talking a few minutes ago regarding different topics that are relevant for people 50 and up. And I know you've got a great presentation for us to, for those who are curious about what occupational therapists do and how different they are from physical therapists and, your specialty, this is the show for you. So, Michelle, I can't wait for you to share with us your knowledge.
Presentations kind of focusing on what physical therapy, occupational therapy are, some fall prevention things, and some exercises. So we'll get started. So my name's Michelle. I'm an occupational therapist. I have mostly worked in the acute care setting, so mostly hospital setting with a lot of different diagnoses, and then acute care settings like Spalding and Compass, where the focus is physical and occupational therapy. I've also done some shadowing in home care, outpatient pain rehab, and neuro rehab as well. So kind of went over at the beginning, OT versus PT, what settings we work in, how to prevent some falls, and exercises to do. So what is occupational therapy? So a lot of people think it has to do with getting a job. It does not. We consider an occupation anything you do throughout the day. So getting up out of bed, getting dressed, driving to work, working. For a kid, it's being in school, writing, handwriting, playing with kids. For older adults, it's grocery shopping, meeting up with friends, going to the senior center, and still working too. So some of the definitions of the National Institute of Health says the goal of occupational therapy is to improve the skills that are needed to live life as independently as possible. So you need to get up and get dressed. We work on all the little things that are involved with that. And what we do is use everyday life activities. The definition from the American Occupational Therapy Association states, so we use everyday activities to promote health, well-being, and ability to participate in the most important activities in your life. So I like to think of an example. If you hurt your shoulder and you're a painter, exercises that promote movement of the shoulder are also painting. So we, and that's meaningful to you, we would implement that in your therapy. And then the Oxford English Dictionary says a form of therapy for those recuperating from physical or mental illnesses that encourages rehab through the performance of activities required in daily life. So similar to the painting example, or if you're having trouble brushing your teeth, we work on brushing your teeth. So
Michelle, before you go any further, I don't think I've ever realized how personalized occupational therapy is. I always, assumed as a nurse that there are general bits of exercises that OT, people like yourself, would help people who are, maybe stroke victims, people who, cardiac rehab, like you mentioned, somebody who broke their shoulders, helping them paint. I never realized how you said meaningful for that person.
Yes.
So it depends on what is important for that person, right?
Right.
Oh, okay. Wonderful.
So we try, that's part of the definition of OT, and we try to tailor it where, like, in the hospital, it's meaningful to get out of bed. Mm-hmm. So we usually start with that. But as you get more and more specific into outpatient hand therapy and things like that, it can be more individualized.
Mm-hmm. Okay. Thank you.
Yeah. So occupational versus physical therapy, we're pretty similar, but OTs do focus a little bit more on vision, cognition, and adaptive techniques for fine motor tasks and sensory skills, which you usually see more in early intervention or in the school system. So we focus on the ability to perform a task. So getting dressed, driving, making a meal, whereas PT focuses more so on the ability to move. So the strength you need to do, can you lift 5 pounds? And we're saying, can you lift a gallon of milk? So very similar goals to rehab and make someone more independent, but different kind of techniques and different things that we look at. I think I go into that. Yeah. So on the next slide. So hospital setting, both PT and OTs work in the hospital, and we work together a lot of times because, like I said, we both want people to get out of bed. And if the patient has to go to the bathroom before they walk down the hall, PT will take them to the bathroom. They're not going to ignore that because that's more of like OT's scope. But that being said, the OTs will focus on specifically getting dressed. Like a PT will help you get dressed if you have to put shoes on to walk. But OT, we're really looking at how you go about that and how you get your socks on. Can you see the sock? Are your fingers, do you have sensation? Do you have the dexterity to hold the sock? Do you have the sitting balance to bend over and the leg flexibility to bring your leg up to do that task? So we look at just different parts of the task, but always with the goal of independence.
Mm-hmm. Yeah. Yeah. Such as like for people who have a hard time bending down, I've seen some patients who has been given the long, is it like shoehorn?
Yep. I have a slide on that coming up. Yes. But also to explain like what, if you've ever been in the hospital or have had a family member and visiting and PT comes in or OT comes in, kind of what the role is in the different settings. So in the hospital, generally, when you get admitted, you might see us if the doctors or nurses notice you're having some difficulty moving. And then our first job is to figure out where you're going to go when you leave the hospital. Like if you need to go to a rehab before you go home, if you need more support at home from family members that don't typically provide support, if you need home therapy. So if you go to a rehab, it's already been determined you're not safe to go home. So we'll work on the things that progress you to being independent. So decreasing your fall risk by improving your balance, making sure you're able to dress yourself and go to the bathroom by yourself safely. And then once you've passed that step, home PT and OT like kind of make sure everything is safe at home. Or if you haven't practiced stairs and you're not comfortable on the stairs, they'll take you on the stairs in your home, which is more tailored to where you'll be. So home therapy can be really beneficial as like the step down from rehab or hospitals because they can see what you're working with and the actual setup of your home. And then outpatient is more using modalities and equipment to like fine tune things. So if you are a musician and you want to be able to play your guitar again, but your carpal tunnel or any type of, you've had a hand surgery or a stroke, they'll work more on those extra things like sports, going back to work, hobbies. So that's more when you're functioning well and you can get around your house and you can get yourself to therapy. Falls are I wanted to bring this up as something because it's one of the most preventable things you can do to not get hurt and not end up in the hospital, rehab, home therapy, outpatient. So to start off, what is a fall? So it's defined as any event that leads to an unplanned or unexpected contact with a supporting surface. So it's not like a push or pull or a push or shove or like fainting heart attack event. It's more something like mechanically. And a near fall is a stumble or loss of balance when you're unable to catch yourselves, which if you have a near fall, you're more likely to have a fall. So it's something to consider when you're wondering, is this safe? So another big reason it's important to talk about falls is they are 1 out of 5 falls results in an injury. So a broken bone, head injury. 3 million people are treated in the ER for fall-related injuries. 800,000 patients per year are admitted to the hospital due to a fall. Hip fractures, head injuries, then the cost of healthcare on healthcare dollars is a lot. And like I said, these are one of the most preventable things that can end up in the, you can't always prevent a stroke. You can't prevent a trauma, a car accident, things like that. But there are ways to prevent or decrease your risk of falls. And that's a big part, big thing OT and PT we do in the hospital and at home. So you are at increased risk for falls for all of these reasons. The bolded bullets are the ones that are treatable, and that OT, PT, or family and friends can help. So there's a few things on the next slide, but the ones I want to highlight are vision, weakness, arthritis and joint pain, endurance, and a sedentary lifestyle. So those can be fixed with exercise, movement, and then things like, I think I said vision before, but vision, footwear, home hazards, those can be prevented by changing the environment. Yeah. So the next slide, yes, so we can help with home hazards, suggest getting rid of things or where to put rails in your house. Things you can do on your own without a PT and OT coming over to tell you are get rid of throw rugs, cords hanging around, extension cords, poor lighting. So especially at night, if you're someone that gets up and goes to the bathroom and there is a trip hazard or anything in the hallway, having night lights or leaving lights on or dimming them can help so you can see where you're going, especially waking up in a fog and not really knowing. And then inappropriate footwear, flip-flops, anything without backs, not great. We really suggest like nice running sneakers or walking sneakers, and even in the house, because socks you could slip if you have nice slippery floors, or rugs as well. Using a cane or a walker incorrectly. So that's something PT and OT could help with at home too, or in the community. Leg weakness, so that's some exercises that we'll go over, along with decreased endurance and limited flexibility and balance. Endurance is like becoming fatigued too quickly too. So we work on like energy conservation things, like sitting down when possible to do things to save your energy for tasks that you really need to do in the house. I usually tell the patients, like, if you're chopping vegetables and you could do that sitting to save some energy for when you have to stand up and walk around the kitchen to cook, that's a helpful tip. Impaired vision, the lighting is a big factor. Also for falls, if you put brightly colored tape on the steps. So usually the steps inside your house. And then if you have vision, like any type of like macular degeneration, glaucoma, the bright tape on each step will really stick out, and it's also a trip hazard to catch your foot or your toe on it. I think we can go into more home hazards. There's a lot. Clutter, shoes. I think I mentioned the cords, but shoes, anything that's in the hallway or in the room that would be in the way. Throw rugs, I'll say that again. Keep items you use often in easy to reach cabinet. So if you always use the same plates, don't put them all the way up where you have to go on your tiptoes, or all the way down on the bottom shelf where you could also tip over. Pots and pans, if you don't mind it, keep them right on the stove when you're not, don't leave them on when the burner's on. But if you're going to use the same frying pan every day, same bowl to boil your water, is leave it on the stove. Handrails in the stairwells, always good. Grab bars in the shower and around toilets. I will say that a lot of people get the like suction handrails. They seem great in theory, but if you were to really yank on them and they came off the wall, it's not good. So having them more installed by a contractor or someone that is good at construction, doing that, not using towel racks, those are not going to hold. It might be okay if you're just touching them, but if you really need them or you slip and you use that, that's not gonna help you. It's gonna go right down with you, unfortunately.
Michelle, quick
yeah.
question about
Yeah.
the grab bars. I totally agree about the suction ones because they give a false sense of security,
Yes.
right?
Yes.
Don't know the suction behind those little, and how old they are too. What is the proper height and angle for grab bars? Would you know that?
So it kind of depends on the home. That's a big reason why we'd suggest having like the home OT look at it, because especially home therapists, they're really good at doing that. I mean, I could say, a little above like mid torso, but that might not work for everybody's shower or everybody's, it's good to have someone come in. So oftentimes we'll make suggestions in the hospital, and if someone goes to a rehab, they'll do home visits to make suggestions, or also if they're going to get home care, they'll have the therapist at home, like see their house and make a decision. Because there's also shower chairs that you don't need grab bars if you have. So there's bath benches, that can sit outside the tub, so you can sit and swing your legs over and you don't need a grab bar because you won't be standing. And then there's a commode. You can take the bucket out and put it right over the toilet. And then you have the handrails and you don't have to install anything if that fits in your home. So it's really like place, home by home kind of thing. It's hard to make a general consensus, but the commode over the toilet and shower chairs generally fit most places. So if you're considering installing a grab bar, I would say to get a commode first for the toilet, because you won't be drilling any walls. Same with raised toilet seats too. They just sit on the toilet, and you don't have to drill or hammer or screw anything. So those are good too.
That's a good point with the using the commode first for the toilet.
Yes.
So on either side, something to kind of help yourself, get up. That's a great idea. Thank you.
And they're adjustable, so you can adjust the height and figure out what works and decide if you want to make something more permanent. Or just don't make it permanent, because then you could just take it away if you don't want it, and it sits right there and it's stable and secure. So
very good.
Yeah. The last bullet was non-slip mats in the tub, and outside of the tub when you get out, not like a rug that could pull up and be another trip hazard when you come out of the shower wet. And always, if you have the option in the shower, sit on a shower chair or a built-in one you have. Not getting up from a tub is a big fall risk, because you're all the way down on the floor pretty much. And then if you are worried about slipping, getting in and out of the tub, I would say get a chair.
Yeah, that's a good point. For people who have bathtubs, as you get older, it makes it really hard to kind of, get over get into the tub. And it's so slippery sometimes.
Yeah.
And then be able to get back out. And also, if you fall in the tub, it might be trickier for other people to pick
Help.
you up.
Yeah.
Yeah.
Yeah. Yeah.
Some-
So I say when in doubt, just get a chair. It's nice to sit down in the shower. Nothing wrong with it.
Yeah, very good point. Yeah, and
Yeah.
they actually have shower chairs if you can't afford to get rid of your bathtub and that's the only one you have, there are shower chairs that can kind of like half sit on the outside and also in the tub, right?
Yep. Yep. Bath benches. Yeah.
Yeah.
And
We
so
can
you sit, swing your legs, and kind of like slide in.
Yeah.
Especially good for like after a hip fracture or knee replacement or anything like that too. Or just where prolonged standing in a hot shower is maybe not safe.
Yeah. Which actually you just made me remember my days when I used to take care of patients, orthopedic patients who's had hip surgeries and knee surgeries. And they would ask, how come I need a raised toilet seat? This is for the people post or after a hip surgery.
Yeah.
They don't understand why they need, raised toilet seat and why they have to sit a certain way. Can you explain a little bit about that? Why?
For post hip surgery?
Yeah.
Yeah. Well, the precautions or the things they don't want you to do are bend past 90. And it's also easier to stand up from a higher surface because you're already almost, a little bit further up than in a regular height chair or toilet. Yeah.
Okay. Thank you.
Yeah. And the next slide has some more adaptive equipment, like the things you were talking about before. So on all these things you can get, they're on Amazon, and often some of them are bundled together. The top 4 bullets are usually in a bundle called a hip kit because it's for after a hip replacement when you're not supposed to be bending or bringing your leg up. So a reacher can be used to get dressed, as well as get things off a high shelf or a lower shelf so that you're not bending down, or just picking something off the floor. If you dropped a sock and you don't want to risk it, use the reacher to get the clutter out of the way so you don't trip on that. The sock aid is what's in is this one here, the white with the 2 handles. And you put the sock around it and you throw it down and you pull up your sock and you didn't have to bend down. Long-handled shoehorn is the yellow. That's the same thing. You don't have to bend down so far to reach behind and pull your heel into the shoe. The dressings, the long-handled sponge. I don't think there's a picture, but same concept. If you're sitting in the shower, you can reach down for your legs and your feet without bending over. The dressing stick is right here, and that is similar to the reacher. I don't really suggest getting both unless you find that one works more than the other. I think the reacher is a little bit more universal. But the dressing stick has hooks to pull down socks or pull up pants, similar to the reacher. So I think the reacher can be used for more things. So I usually suggest that. Toilet tongs you can use for some toilet hygiene if you're unable to reach behind you. I don't have a picture of those. Night lights, like we talked about before, in the hall, just to line the hallway, and the tape on the steps can help with seeing the stairs at night, or just in a dark hallway.
Now, silly question. Is there a particular type of night lights that you recommend for people, like the ones that automatically turn on when it gets dark, or the ones
I would suggest that, just so you feel less wasteful, less like energy consuming. And those are usually like they're light enough to see. Yeah. So this is a lot of information too, and some things people watching may not need yet or ever. and they're not sure how to go about figuring out what they need, and or if they need anything. So but one time where you would need home services would be after a hospitalization. And I think you can get a home evaluation recommended by your primary care physician, but it usually comes after you've had a hospital stay. And a PT, OT, or nurse comes to the house and they determine what kind of services you need, if you need all three of those and how many times a week, or if you just need OT and nursing, or PT and nursing, to get you back to where you want to be functionally. And then outpatient services come from your primary care physician. And so we can recommend that in the hospital as well. But typically that comes after if someone's concerned, like my wrist is hurting, or my shoulders, I'm having trouble with my shoulder, or there's knee pain, they'll suggest going to outpatient physical or occupational therapy and kind of like we talked about before, fine-tune things and figure out how to help get you back to where you want to be.
So let me just ask you this. So the difference between a patient needing to go for outpatient services versus them needing home OT. So the home OT, the purpose would be for what? To make sure that they're able to move about and do what they need to do in their home.
Yeah, so then they're safe at home with the basic things like getting yourself dressed, making a small meal, taking yourself to the bathroom, showering, and you're able to get outside of your house to go to outpatient. So if you're able to get out and about, you wouldn't need home services.
Okay. So fostering independence with whatever patient they might be having. And then for people who they go to outpatient OT. Those are the people who want to strengthen part of their limb or their arms or shoulders. What is it?
Yeah, more like they're able to do the basic things, but they want to like go above that or make those basic things easier. Like if they get themselves dressed, but it's very, very, very painful, or they're having a lot of back pain, or go to physical therapy. If they're not back to typing properly and they need to type for their job, they'd come to hand therapy and we'd like figure out exercises or stretches for that.
Okay, so for in some cases then, would somebody who's getting home OT services, if they want to maximize their ability to, fine motor skills, pick up things, or move their hands even more, would they then transition to outpatient services?
If they are able to get out, like if they're able to, the only thing they have trouble with is that they would kind of like graduate from home therapy and find like a hand therapist to do that. As long as they're able to, the fine motor deficits didn't affect their ability to get dressed, and brush their teeth, do like grooming tasks, and they were able to get out of the house. If they also had vision impairments and they can't drive and they can't get down the stairs and they have no one to help them, then we'd say home therapy for that.
Got it. Yeah, I remember when my mom was suffering from carpal tunnels, I would bring her to outpatient. And this particular occupational therapist had a specialty, extra education on, I don't remember if it was for fine motor skills or I don't know what type of experience he had, but he was, he had a lot of, expertise in, helping somebody with carpal tunnel. And, he would have my mother do these exercises that, a lot of people would say, oh, my gosh, that's easy. But if you're suffering from carpal tunnel, picking up, all these little tiny beads and then putting them in one location and making sure that you're able to find them or grasp them without dropping. really quite the task.
Yeah. And that's they often do that exercise with like coins because then it relates to money. Now we use credit cards and all that now, but before it would be kind of like a more functional task of money management too. So
yeah, that's great. And they had the special heating pads also before
right.
each training.
Like that's more of what the outpatient would be. They have more modalities like heat, ice, ultrasound, more than your basic.
Yeah.
Things that home care is like, you're not going to fall at home, right?
Mm-hmm.
And outpatient, there's no fall risk for you. It's just those extra.
Yeah. That's great. I'm glad we were able to delineate the difference between the two because, some people might say, oh, I'll just go for outpatient services. Maybe they don't need that. What they need is actually home services.
Yeah. If you're falling at home, usually suggest home first because we can see your environment, see what's going on. And if it's a true balance thing and you work on the balance at home and it's still not totally what you want, then you could go to outpatient.
Great. Thank you.
Yeah. So some of the things that we can't really change as easily as getting rid of throw rugs, getting rid of things in the way and putting on the best shoes are weakness, endurance, and flexibility. So the best way to do this, to gain weakness, to increase endurance, or not gain weakness, prevent weakness, increase endurance, and increase flexibility is to be active. So that doesn't mean the gym 7 days a week for hours on end at all. Something is better than nothing. So slowly increasing your activity level. If you're someone that doesn't work out, don't go running around, go on a run for the first, that's your first activity. No. Yeah. Slowly increase things. And if you do have like a chronic condition that you're not sure about, like any kind of heart condition, pulmonary, or an orthopedic, like a back pain, you don't want to make that worse. You don't want to exhaust your heart too much or your lungs and risk something else happening. I would say consult your primary care doctor because, like you said, there's cardiac rehab that's also outpatient. There's pulmonary rehab. There's outpatient therapy that can help you get on like a little bit more of a regimen that's scientific based and going to keep you safe. But if you feel good about exercising and you just need to get back into it, a good thing to do is get other people involved, kind of get some accountability. You're not doing it alone. It's your preference. Sometimes, some people think it's more fun to walk and talk. Some people want to have alone time and go on a little walk by themselves or work out by themselves. But if being social motivates you, it's good to get, some other people involved. And the biggest exercise that I always tell people to do is just walk and listen to your body. If you walk around the block and that's enough, it's better than nothing. If you walk around the block and you feel good, do it again. But also we're getting into the fall, so making sure it's an even surface, like a track, a local track, a treadmill if you go to the gym or you have one at home, or it's not a uneven sidewalk or driveway. Don't want to trip. Yeah.
Some people like to go to the mall.
Yes. Yes. Yeah. That's a good one. And creating a schedule always just kind of helps. If I say I'm going to the gym after work on Tuesday, I'll pack my clothes and I'll go to the gym after work on Tuesday. If I don't make that up, I'm not going to go to the gym on Tuesday unless I planned on it. And the last thing is to figure out what motivates you. Like I said, if you like to walk and talk with friends, there you go. If you like dancing, do Zumba at the gym or find some on YouTube. If you like to watch TV while you work out, put on the TV or do an exercise video that has the people doing it in front of you. Anything that you kind of like, listening to music while you're walking, listening to a book, something that gets you to do something.
Yeah, it's very important to feel motivated. And like you
Yeah,
said, whether it's having an accountability buddy or attending a class and watching people do it, even if you're sitting down or not able to keep up with the pace, at least you're there, you're being engaged, and maybe
right.
you can set yourself a goal and say, by the end of next month, hopefully I could just kind of join for 10 minutes, so just kind of making it realistic for yourself without not doing anything.
Yeah. And local gyms too, like I think I've had somewhere like the Y or anything like that. They'll also have classes that are like the class is really motivating too. And like you said, they adapt. They say, oh, if you can't do this, then do this. And like you said, you can sit on the mat and just say, I'll do the first 15 minutes. I'm gonna take a 10-minute break and go back to it. Even though you're in a class, that's what you're there for. You're there to get stronger. So I would kind of weave this in, like if you're not feeling good, don't do it. It shouldn't be in pain. It should be like a getting stronger pain, not I'm at like a 5 out of 10 and or like could get to a 10 out of 10 of pain if I keep doing this. And if you're finding that your exercises are always causing some pain, or you can try to switch it up, but then again, I would ask your primary care doctor, because you could also, there's athletic trainers at gyms, there's personal trainers that also can help tweak things to you if they're there with you. But there's definitely benefits to like YouTube videos for things, like as long as you're being careful about it and listening to your body and not going all out. Another thing that's good to do is set up the space before you exercise. So similar to fall prevention, clutter, and then having everything you need right there. So you're not like, oh, I won't use the weights today. They're in the other room. Get everything you need, including water, so stay hydrated.
I love how you are reminding people to set themselves up for success. Making sure you have everything ready, even like scheduling your workouts on your calendar so you can't say no to yourself.
Yeah.
Having accountability buddy, like I said, going to the gym, even senior centers, they have so many different activities out there. Even the sheer fact of you getting out of your house, walking from your house to your car, into a new place, new space, can really help motivate you to start moving a little bit more and being more active.
Yeah. Especially if you make it social too, and you see the same people every time. It's like they don't see you one week and you're like, where were you? Like, I was decided not to go, and kind of holds you accountable.
Mm-hmm. Yeah.
And I do like to say too, like a lot of low impact exercises like Zumba, walking, I always say, and Tai Chi is a pretty good exercise too, kind of like keeps the joints moving, but you're not doing any heavy, like CrossFit, heavy lifting kind of thing.
I agree. I mean, there's going to be older adults out there who are, they love the like the pickleball,
Right.
or volleyballs, and that's great. But again, for those people, listen to your body as well, right? And making sure that you're hydrated and making sure that when you're moving, that you're careful, because there's an increase in pickleball increase out there.
More people doing it for sure.
More people doing it. It's not just older adults, it's becoming more and more popular, but just making sure that you are attending the class at your level and that you're not overdoing it.
If, like I said, if something hurts, make sure it's you're strengthening yourself hurt and not hurting yourself hurt, which can be hard. Like if you grew up doing sports, it's easy to figure that out sometimes. If you didn't, then sometimes you're not sure, like, should I feel like this or should I not? That's where it's like consult somebody else too, instead of doing nothing.
Yep.
See what advice you can get. So there are some exercises I have. These are just general. I don't want to go through all of them, but the seated ones are good to do, especially too if you're just starting out, getting back into exercise. So just like cervical head rotation, flexion, shoulder rolls, twists, seated march or scap squeezes are pulling your shoulders back. Seated march is exactly what it sounds like. You just bring your legs up and down.
Sorry to interrupt. Can you with the seated exercises, can you just explain like briefly what the benefits are? And also for the cervical rotation, some people think that they have to kind of like hyperextend their neck. Is that I heard it in both camps. It do that, and then some people would say don't hyperextend, just look up enough that you can see the ceiling, so that way you're not hurting your neck.
Mhm.
What's your thought on that? And also, what are the benefits of these seated exercises?
Yeah. So the seated exercises are good to just get like a warm up too. And they just promote range of motion and flexibility in pretty much all of your joints, all the way down to the heel toe raises. So we start, head all the way to heels and toes. So that's good to do if you're, it's good to do if you're just starting to really exercise. And just to do before you do an exercise. So maybe you do this and then you go on a walk, or you do this and then you do a Zumba YouTube video. So it's kind of a good warm up.
Mm-hmm.
And the neck, I would say, like, I always kind of say, listen to your body. If it hurts to go past whatever point, don't go past that. Stop at that point, hold it, and then go back, so that you're promoting the flexibility, but you're not overdoing it. So same thing with going up. Like if it hurts too much, just go to where it hurts and stop. With any really stretching too. Especially like the neck ones are important, and the thoracic ones. Just don't go to a point where it's painful. And one, you don't want to hurt yourself, and two, you don't want to exhaust yourself, and three, you don't want to hate it so much and never want to do it again, and then that's out the window. So those are good seated ones. And then standing, it's always good to kind of hold on to a surface too, like maybe the back of the chair you did the seated exercises on, and they're kind of exactly how they sound, like marching, kicking, sidestepping. Balancing is more like doing some of these without holding on. And sit to stands, kind of without using the armrest of the chair, and kind of standing like this. Heel toe standing or walking, so that's like walking on a tightrope, to promote balance. And more shoulder blade squeezes. That's similar to the sitting ones, but you just do it in standing and challenges your balance a little bit more. These are just some of the basics, but it's good to start with something, especially promoting range of motion, because that's also a big one, along with Zumba, which adds a little endurance. Yoga is also a good one, gentle yoga. And that can start with chair yoga. And I know there's gyms and senior centers and the Y that do seated yoga. And then you can, move up if you want, or stay if you like seated yoga. It's a great way to get some range of motion and flexibility, which helps you keep walking as long as possible and prevents falling. Yeah.
I'm looking at the seated exercises, and I can't help but think that these exercises would be great in the morning.
Yeah.
Especially like it's getting cold out there. Sometimes people with arthritis, they need a little bit of warm up so that their body's a little bit more looser before they step out of the house, even before you drive, because some of these movements, like you have the lateral flexion and the vertical rotation, shoulder rolls, how you need parts of our body that we really take for granted for driving.
Yeah. Even before you get out of bed, if like you said, arthritis, you wake up stiff doing some of these, you don't have to do all of them. Like just a little movement before you get up can also help, especially your legs, stretching them out a little bit can help with the walking once you get out of bed and you don't feel like you're super stiff when you move throughout the day.
Yeah. And what's the benefit of the scapula squeeze? What is that? What does that do? Does that just kind of help expand the lungs to make you breathe?
Yeah, opens up your chest. A lot of people, can get that rounded posture with the shoulders rounded forward, and this kind of promotes the shoulders back and the chest open without having to think about it. Then the stronger those back muscles are, the less you have to think about holding them. They'll just hold you up on their own.
You talked about the difference between OT and PT, and I remember being a new graduate nurse, and I'd see, again working on the orthopedic floor, I'd see OT and PT. I always used to get both of them confused. So thank you for explaining the difference. So as far as for people getting in and out of cars, are there any type of devices? You mentioned some of the devices that people could use to help themselves get dressed or maybe reach for things around the house, like the reacher. Are there any type of devices that can make it easier for people who are, maybe short or have shrunk throughout the years, or maybe, need a little bit of an extra boost to kind of get themselves out of the car because maybe they live by themselves and they still can drive? Are there any type of devices out there?
Yeah, there's a one that you stick in, like once you open the car door, it sticks into where the hinge is. And that can help. I've used it once a few years ago, helping someone get home from rehab safely. I believe they have them. I've seen commercials for them lately. Yeah, and those are good as long as they're nice and sturdy and you figured out someone has taught you how to use them and they're not gonna come off while you're putting all your weight on them. But yeah, those are good too. Step stools for getting into like a high car, but then you'd probably want to have someone with you because you have to get the step stool. Yeah. Unless you leave it at the same spot and you park your car right up to it.
That's a good point about the step stool. Yeah. How about for people who are short? Are there any type of paddings that they could put on the seat to help them kind of see better across the?
I would say if you put the seat height up as high as it goes, and then it's still not high enough, you could put cushions, like regular seat cushions, or pillows tend to sink, but cushions can work.
Okay. Yeah, that's a good idea.
As long as you're not sliding.
Yeah, definitely. And for people who are maybe they had shoulder surgery and they're not able to kind of reach, and they're drivers, are there any type of special devices out there for car seats so that people could reach for them?
Not really that I know of. You could leave the seat buckled and then get in and out, unbuckle it, but hold it there when you sit.
Oh, that's a good point.
But yeah, not really. If you're having a lot of trouble turning too with your neck, we don't really want you to drive that much.
Exactly.
But if you can't safely get the seatbelt on, I wouldn't suggest driving.
Definitely, but
yes, there's ways, and people will.
There are ways, and that's where your seated exercises would come in handy before driving, is to really do a couple of set or maybe a one set of those seated exercises to help somebody feel a little bit more looser
and stretch your arms. Yeah,
definitely. Now, the OT would usually work with PT. Are there any type of specialties that you would also work with to help people, rehabilitate? Would it be like speech or,
Yeah. Well, so PT, OT, there's lots of specialties within. OTs are definitely hand therapy mostly. More than PTs don't typically do hands. And then speech can be used for if you've had a stroke and you're working on that the swallowing or the speaking, like aphasia, word finding difficulties. Some places I know have like rehab aides that help with doing the exercises when like PT and OT, they, it's an extra like service for them at a rehab to get extra um, like extra time doing the exercises. But mostly, and athletic trainers too. But we don't. Where we are, we don't work with athletic trainers, but they are a good resource because they know anatomy and physiology and that kind of thing too.
Mhm. Now, as far as occupational therapy, I can see how much needed they are in fields or in for people who have disabilities. They not necessarily have to have like an injury or surgery, but for people who don't have use of, one side better than the other, there must be, lots of other devices or gadgets out there to help a person become more independent. That's where OT would also come in handy.
Yeah. We work on like hemi, we call it hemi dressing if you're hemi body or like paralyzed, hemi dressing techniques, different walkers too. If you can't use both hands, there's one-handed walkers, different devices for that. A lot of more with kind of like if you had a brain injury or a stroke or something where one side isn't working as well, it's mostly we call it the adaptation like domain. Instead, we're not rehab. We work on getting that side stronger, but in the meantime, we work on techniques that will also help you be more independent. So we're not saying that arm won't get strong, but we want you to also still be able to dress yourself while that arm is getting stronger. So we work more on like adapting the task, like, and that's what like adapting the getting dressed using the sake. That's an adaptive technique or a assistive device. So we adapt the task instead of adapt the person, I guess.
Basically meeting the person where they're at.
Yeah.
With a goal and
yeah. Like we still want you to be independent, but we still want you to get stronger. But if you're not, can't make those happen right away, we have to figure out a way to you to be independent and get home and be safe while you work up to whatever it is that you want.
Now, I usually ask this question in the beginning, but I didn't this time. So I'm wondering, what got you into wanting to become an occupational therapist?
My mom is an occupational therapist. And she worked with adults, she worked with kids, and I really wanted to work in the mental health field. And there are occupational therapists that run groups in mental health. Just kind of in the same vein, like there's need motivation to get up and go grocery shopping, or they've had like a type of like eating disorder where cooking is very much like hard for them to do. We work on coping strategies to get people to be able to do those things again. And my mom said, you'd be a good OT. Just do OT instead, because then you can do mental health if you want, but if you find you like other areas, then you can switch more quickly than if you went into psychiatry. So I'm glad she did, because now I like the hospital setting and more of the acute care injury stuff than the mental health side. So
yeah. Wow. Yeah. I've never really, and I'll be honest with you, I never thought that there's a need for OT in mental health, but the way you explained it, wow, that's really amazing. That's really amazing.
And even my mom worked in a school with adolescents that were in like, they couldn't be in their regular school, and elementary school kids. And they had bad, like regulating their emotions. They had like trauma history, some kids with autism. So it was a way to get them to be able to do school. School was their occupation. So what kind of adaptations for the classroom needed to be made for that kid to learn?
And yeah, there's a lot of need for that these days too. Yeah, with a lot more younger adults or kids, children being diagnosed, which, it's really, the diagnosis is so important because it then gives them the ability to get the services that they need.
Yeah.
That's great. That's wonderful. Can you also share with us what are your experiences? You mentioned that you worked in rehab, I think, and also a little bit of home care. Can you, through your lens, how was that for you? What's the difference, and which one did you like the most, and which one do you think you'd find yourself doing a lot more in the future based on your experiences?
I do like the hospital setting, like the acute care setting. And I've been doing the ICUs lately, and it's like rewarding and fun to get someone up for the first time that they've been in bed for, I don't know, a month or more, or even if it's a week. The first time someone gets up and showing them like, you can do this. There's like, and this is the trajectory for it. I like to like kind of be there to like tell them what can happen. Even though it seems terrible right now, it's nice to be able to like say, no, I've seen this and it can get better. Mm-hmm. So I like that, like acute in like initial phase, I guess.
Yeah, and that's so important because, when you end up in the hospital, especially in intensive care, the body gets so weak and deconditioned. And to have somebody who knows how to get a patient up who's been in bed for a long time, that requires a lot of skill because you can't just kind of get them up and plop them on the chair.
Right. Especially all the wires and tubes and drains.
Yes. It requires a lot of acrobatics sometimes and flexibility to kind of maneuver. I know. And you know what? As a nurse for many years, I always appreciated when PT and OT would be there to help get the patient up the first time. Because again, you got to do it slowly. You got to do it carefully. And there's education happening. There's motivation happening. And really, it's so important.
Yeah, it's mostly, like part of a team, kind of all of us together. It's kind of a good way to think of it.
Yeah.
All for the same goal, getting the patient out.
Exactly. So we're 2 minutes until the end of the hour here. So what are some tips or takeaways that you want people to have? You've shared so much with us, what OTs do and exercises and the range of specialties. What are 2 or 3 things that you want us to, take away from our conversation today?
I think the biggest thing is fall prevention, because like I said, in the ICU, in the trauma ICU, I see so many people from a fall, and the ways they can be prevented. Sometimes they can't, like they passed out or something like that, but so many times they fell down the stairs, or winter's coming, they slipped on ice. So just being a little mindful, not to the point where you don't walk, because that's the best exercise to do, but where you're safe about it. If you feel unsteady, maybe ask your doctor if you need to get a cane or a walker, or try one out and see how it feels. If you feel safe with it, use it. You're going to feel really silly if you think you don't need to do something and then you end up falling in the hospital. Better safe than sorry, I guess, is what I mean. And then just the second point would be to start with the exercising slowly. Like, don't go crazy, because 1, you could get hurt, and 2, you could get really sore and then not want to ever do it again. And and then I guess the third point would be finding a way to exercise that motivates you, or something you want to do again that doesn't feel like a complete chore. Can we feel a little bit like, it's not going to be easy, but something that motivates you to want to do exercise and stuff.
Thank you so much. You've shared with us so many great information, and I know the viewers out there will have a better understanding on what occupational therapists do. And also, hopefully, if they are finding that they need extra help with, they're getting weak or they're not able to do certain things, maybe asking their primary care providers for, a consult.
Yes.
They can be evaluated appropriately, and they're not, trying to MacGyver certain things for themselves, but doing it in a proper, safe way.
Increasing fall risk by doing crazy things that could be helped by therapy.
Yeah, exactly. Well, Michelle, thank you so much for spending the time with us.
Yeah,
Really
thank you for
learned a
having
lot.
me.
Thank you. And I want to thank the Quincy Health Department for continuing to sponsor Aging Strong. Until next time, everybody, be safe. Take care. Bye-bye.